Okay, for this week's interesting case, I was a part of a crypt orchid castration surgery, and the retained testicle was found in the abdomen. When the horse got there, we sedated him with some xylazine, and Dr. Sakai ultrasounded him to try to see exactly where the testicle was, and the owners did hang around until we kind of established where the testicle was and what kind of procedure we would be doing. And so we pre-medded this guy with Banamine and gentamicin, and then we got him down to the surgery building and sedated him with xylazine. And then when we took him into the surgery suite to drop him for our induction drugs to get him down, we used midazolam and ketamine. And once he was down, we got him hooked up to the crane and moved on to the table. We did not use general anesthesia for this surgery at first. He was just on oxygen, and we kept him on triple drip most of the time. He was very in and out. We'd have to bolus his triple drip to get it. He would start moving, and we'd bolus his triple drip, and then he wasn't really blinking like he should be, because when they are not on Sevo or gas or anything like that, they will still blink at you, which is fine. But it's very slow blink and just like very minimal palpebral reflexes. And when we would turn his triple drip down to a slower rate, that's when he'd really start blinking and his back legs would start moving a little bit. And we had done a bolus about 2 or 3 times, I believe. And Dr. Sakai kind of got fed up with it, so he's like, you know what, just give him some gas until we're done with this, because they were kind of digging around for that other testicle. So we started him on Sevo, turned off the triple drip, and just ran fluids to him. And he was probably only on gas for about 30 minutes or so just to finish out the procedure. And we don't do any post-op pain management. They do that with the pre-med. That's what the Banamine was for. And with that incision that they had made for abdominally for that testicle, they packed it with some gauze and left a little bit of a tail out just to kind of keep it dry and keep the blood absorbing and everything for the night, because he was an older or a more mature castration is what they called it. He was about 2 years old, and so when they get older, they bleed a lot more because everything's more developed, and so they do require these studs to stay overnight after surgery to make sure that no crazy excessive bleeding happens. And it did take the stud probably about 45 minutes or so to really wake up and get up to his feet. But once he was up, he did great. He was doing really good post-op. We did leave his catheter in until tomorrow, just in case he did start to bleed or whatever. We don't need to place another catheter. It's already there, and we can just push drugs and get him down and go from there. But when I left this evening, he was doing really well still. He was eating, he was drinking, and he was up and being sassy. And so that was really interesting to watch, and it was really good, fun to watch the fact that we didn't have him on Sevo for a while, and the main goal was to just keep him on a triple drip. And so that was my interesting procedure for this week.